artificial intelligence. It feels like it's about to change, well, pretty much everything. But there's probably no area where the stakes are higher and the rewards potentially so much greater than in healthcare. AI is promising a full-on revolution in how we diagnose illnesses, how we treat them, and maybe even how we prevent them in the first place. But it's a revolution that's happening cautiously, and for some very, very good reasons. Okay, let's get into it.
So, to really get why everyone's so focused on AI, we actually have to start with a problem that has nothing to do with futuristic robots. It's about today's reality for doctors. A physician used that exact phrase to describe the electronic medical record, or EMR. This thing was supposed to make their lives easier, but for so many doctors, it's turned into a kind of digital ball and chain.
And that's not just, a feeling they have, it's a hard number. Studies have shown that doctors are spending, on average, a staggering 45% of their entire workday staring at a screen, dealing with the EMR. Think about that. That's nearly half of their day spent on paperwork, not actually with their patients.
And the fallout from this? Well, it's deeply concerning. This massive administrative overload is one of the biggest reasons for physician burnout. The rate of burnout jumped from an already high 45% in 2011 to over half of all physicians just 3 years later. And this isn't just a problem for doctors. It's a problem for all of us. It impacts patient safety, your satisfaction, and really the stability of the entire healthcare system.
So you basically have this perfect storm, right? This crushing administrative burden on one side and skyrocketing burnout on the other. You can really think of the whole system as a kind of healthcare pressure cooker. It's under this immense strain, and the very people we trust with our health are being pushed right to their breaking point.
So here's the big question. Could the answer to a technology problem actually be more technology? Let's take a look at how AI is being pitched as a kind of digital diagnosis for the whole system, starting with what's happening inside the clinic. For a really powerful example, just look at the traditional way we treat drug-resistant epilepsy. It is an incredibly high-stakes process. First, it involves invasive surgery to actually implant electrodes inside a person's brain. Then that person has to be monitored for weeks, just hoping to catch a seizure. And after all that, someone has to painstakingly, manually go through all that data. It's slow, it's risky, and it's so much work. And this is where AI just completely changes the game. Researchers over at the Mayo Clinic have built AI tools that can chew through that same neural data with unbelievable speed and accuracy. What used to take weeks of manual labor can now be done super fast, pinpointing exactly where the seizures are coming from. This means patients spend less time being monitored, and their risk of infection goes way down.
And we're not talking about some small-scale experiment here. The Mayo Clinic is working with an incredible 20 million digital slide images, all linked to patient records, to build these powerful AI models for pathology. This is all about cranking up the speed and accuracy of diagnosis across the entire system.
But AI isn't just for these big, complex diagnoses. It's also tackling that death by 1,000 clicks problem I mentioned earlier. You see, instead of just flooding doctors with tons of generic alerts about medications, AI can look at a patient's specific data and create smart, concise alerts that actually help personalize their care. It cuts through the noise. But the impact of AI isn't just stuck inside the four walls of a hospital. Nope. The technology is now moving beyond the clinic and right into a patient's own home to help support their care. This is all possible because of something called remote patient monitoring, or RPM. And the idea behind it is actually really simple, but it's so powerful. It's just about using technology to keep an eye on a patient's health when they aren't physically sitting in a doctor's office. So how does this all work? Well, it usually starts with something you wear, like a smartwatch or another sensor that collects data. That info gets zapped up to the cloud, where clever AI algorithms analyze it, looking for important trends or red flags. And finally, your doctor can see all of this on a simple dashboard and get an alert if anything looks off. But does it actually make a difference? Oh yeah, a big one. One study looked at an AI-powered RPM system for patients who were recovering from heart surgery. The result? A 30% drop in hospital readmissions. I mean, think about that. By catching problems early while people are still at home, it kept them healthier and, crucially, out of the hospital. Okay, so this all sounds amazing, right? A total game changer. But, and this is a big but, with any revolution, you're going to have complications. we absolutely have to talk about the serious concerns that come along with weaving this powerful code into our most personal health information. When you actually talk to patients about this stuff, you get this really fascinating mix of hope and, well, fear. On the one hand, people are genuinely excited about getting more personalized care and having better health outcomes. But on the other hand, they're really worried about data privacy, about the AI making a mistake, and about losing that vital human connection with their doctor. This quote from a patient in a recent study just hits the nail on the head. It really gets to the core of the trust issue. It's not just about does the tech work, it's about who controls this incredibly sensitive information that it's collecting about us. And then you've got the technical risks, which are very real. Some of these big AI models that power these systems, well, they pull their information from the huge, messy, unfact-checked world of the internet. And that creates a serious danger of the AI giving out information that is just plain wrong, medically speaking. Which, of course, leads to this massive question. If an AI system messes up, if it gives bad advice that hurts someone, who's responsible? Is it the programmer who wrote the code? The hospital that bought the system? The doctor who used it as a tool? Right now, we just don't have clear answers. So, where does all of this leave us? Well, to navigate this really complex new world, we have to kind of reframe the goal. This isn't about a race to replace human beings. It's about trying to define the future of human care in an age of really, really smart machines.
And this, right here, is the key takeaway. The ultimate promise of AI in healthcare isn't about creating robot doctors. It's about automating all that administrative junk, about analyzing impossibly complex data, about handling all the repetitive tasks, to free up our human doctors to do what they, and only they, can truly do best, to listen, to show empathy, and to care. And that leaves all of us with the central question for the next decade of medicine. As we bring these incredibly powerful tools into our lives, how do we make sure we're building a system that uses technology to make us more human, not less? That is the challenge and the huge opportunity of this cautious revolution.